My name is Kellen. I am from Kenya, 58 years. I have been doing very well for my past life. About 15 years ago, when I started having issues with my heart, I was done heart surgery in South Africa in 2011, which was very successful. In fact, I'm being told I might start having issues after 5-7 years. After that, I started developing some issues whereby I could not breathe well, I could not walk for long distance, I was running out of breath, and I decided to seek for medical opinions from different hospitals. But finally, I settled to come to India, whereby I did not even know the doctors I was coming to meet. I was just praying that I get good doctors.
We found on echocardiogram that her tricuspid valve had degenerated after 15 years with severe tricuspid stenosis and severe tricuspid regurgitation. After consultation with our heart team, which included Dr. Mukesh Goel, we decided to embark on a transcatheter tricuspid valve-in-valve procedure.
So I gave her an option, and another thing that on echo we found that the right ventricle was working very less. So there was a great danger for a reoperation. We were worried that while stitching back the chamber of the heart after replacing the valve, we might not be able to achieve that, and she may continue to bleed. Another thing that her right ventricle is working very, very less compared to her normal function, and she might have a difficulty in post-operative period because of that.
They were there on time, even when the echoes, everything, procedures were being done. The cardiologist was there, the surgeon was there, and really, I cannot recommend any other doctor apart from those. I'm not saying the others are not good, but from my past experience, those ones are the ones I'm telling everybody. If you have to go to India and you have a heart issue, you don't have to look around.
We decided that the newer option, which has fortunately have become available, which was not there in around 5-7 years ago, that we replace this with a transcatheter procedure, where a tissue valve is implanted in the previously implanted bioprosthetic valve. So it is a non-surgical approach. So my colleague Dr. Gautam, who's trained in a structural heart intervention as a cardiologist, so we together decided to go ahead with that procedure, keeping in mind the patient safety as well as the recovery.
We implanted an Edwards Ultra Resilia 29mm transcatheter heart valve system within the old surgical perimount valve, and the immediate post-op results were confirmed on transesophageal echo, which was very good. There was very little gradient across the valve, a mean of 2 millimeters of mercury, and the tricuspid regurgitation had been eliminated.
Right now, I can wear whatever I wear, I can walk, I can do many things. So I'm very, very grateful about the whole procedure. For Dr. Naik, he's always very jolly, very, always talking and asking questions, and Dr. Mukesh is there on the background, always, checking on my results and all those things. So up to now, I'm so happy.
So a transcatheter tricuspid valve-in-valve procedure is a complex procedure which is done at Indraprastha Apollo hospitals. I would also like to thank the Apollo Heart Valve team on behalf of helping us out in critical decision making.
So I really thank Apollo team. I thank Dr. Naik. I thank Dr. Mukesh, who has been fantastic.